Hello everyone. In this video, I'd like to talk about the relationship that B vitamins have with the cardiovascular system and their effect on reducing the risk of cardiovascular disease. So B vitamins, and I'm going to put this right here so that you guys can see the relationship. B vitamins can help lower cardiovascular disease risk. But how do they do that? Well, first of all, there's a molecule that's known as homocysteine. And what B vitamins do, they reduce homocysteine levels. Homocysteine is an inflammatory molecule, and we know that inflammation increases the risk of cardiovascular disease. So by reducing homocysteine, this lowers cardiovascular disease risk. Also, homocysteine can damage the lining of your arteries, your blood vessels, and lead to clots. So by lowering homocysteine levels, you prevent clot formation and cardiovascular disease from happening. So reducing homocysteine is protective against cardiovascular disease. So how can we reduce homocysteine levels? Well, there are several B vitamins that play a crucial role to make that happen. Specifically, vitamins B9 and B12. So how do they work? Well, vitamin B9 and vitamin B12, what they do is they lead to the conversion of homocysteine into methionine. That's what they do. So by converting homocysteine to methionine, you reduce the levels of homocysteine and therefore reduce the risk of cardiovascular disease. Also, other vitamins which play a crucial role is vitamin B6. Vitamin B6 converts homocysteine into cysteine. So again, you are reducing homocysteine levels. So in short, vitamins B9, B12, and B6 reduce homocysteine levels and thus lower the risk of cardiovascular disease. Now, are there any other vitamins? Well, yes, vitamin B2. Vitamin B2 is very important because vitamin B2 actually can lead to the formation of a molecule that's known as betaine or betaine. And this molecule converts homocysteine into methionine. B2 also can lead to the formation of B9 and B6. It makes more of them. And we already saw what these guys do, right? Again, they reduce homocysteine levels. So vitamin B2 has this indirect effect on reducing homocysteine levels. Really, really important. In addition, vitamins B2 and B3, both of them, okay? So B2 and B3 can actually regenerate glutathione. Regenerate specifically the reduced form of glutathione with the sulfohydryl bond, right? With the thiol SH bond, the reduced form of glutathione. And this can act as an antioxidant, right? This can act as an antioxidant to mop up free radicals and reduce inflammation. So therefore, B2 and B3, by reducing inflammation, right, by regenerating the antioxidant glutathione, also reduce cardiovascular disease risk that way. And then simply B3 can actually also help. Let me choose a nice color for this. Let's do dark blue. So B3 can also reduce cholesterol levels, specifically the bad cholesterol LDL, and by doing that also help reduce the risk of cardiovascular disease, preventing plaque formation, etc. So if you can see here, B vitamins are very, very important. We have to make sure we have adequate levels of those B vitamins because they reduce the risk for heart disease, for cardiovascular disease. And here specifically, we saw the vitamins B2, B3, B6, B9, and B12. These 5 B vitamins are crucial to either reduce homocysteine levels or regenerate the reduced form of glutathione or reduce LDL cholesterol. Regardless of which mechanisms, all of these mechanisms reduce the risk for cardiovascular disease.